Good evening tonight. Vaccine nationalism is on the rise as Europe and the United Kingdom are engaging in a tug of war over a dwindling and limited supply of COVID-19 doses. In the last hour, there's been a reminder of the immense urgency to speed up the vaccine rollout as the world passed 100 million COVID cases and the UK 100,000 deaths. AstraZeneca is now warning that its first shipments to Europe won't contain as much vaccine as promised because of production problems. The EU says the company's explanation was insufficient and is now threatening to restrict the export of vaccine doses that are actually manufactured in Europe. The British Prime Minister Boris Johnson has urged the EU to use common sense and honour its contracts. The EU Commission President says drug makers must honour their commitment to Europe.
Europe invested billions to help develop the world's first COVID-19 vaccines, to create a truly global common good. And now the companies must deliver. They must honour their obligations. And this is why we will set up a vaccine export transparency mechanism. Europe is determined to contribute to this global common good, but it also means business.
Véronique Rillet-Lenoir sits on the European Parliament's Public Health Committee. She's an oncologist by training. She joins us from Lyon. Good to see you. Thank you. The problem is there's not enough at this moment until new facilities come online for Pfizer or production problems are sorted out. There's not enough vaccine to go round. So somebody's going to lose out. Isn't it fair to share that pain?
Well, I think that we have to fight against vaccine nationalism wherever it is. And right now it is worldwide. I agree that if only happy few in healthy countries are protected, then nobody is. So we really have to fight against this kind of organized battle between the countries, between US, China, and Europe. And this is really a situation where the contracts have to be followed. A contract is a commitment. The European Union has contracted with 2 and soon 3 firms, and doses are secured, they are prepaid, there are enough doses to hope vaccinate all the European citizens. These contracts should not be betrayed. And this is what is happening.
But isn't that policy, I mean, what you've suggested sounds good, but if there is a problem with production, honouring the contracts is exactly vaccine nationalism because you are giving priority, I agree, to those who have contracted, but others further down the line will be left out.
Well, there might be, of course, breaks in the production supply chains, but there also might be speculations because, as you very well know, some countries have agreed on higher prices. And the European Union, because it's negotiating in the name of 27 states, has obtained lower prices. This is not a reason why the firms should prioritize higher prices in healthier countries. To be more optimistic, do you know that the French Sanofi just today decided to use its production capacities to manufacture Pfizer's vaccines? So even the firms are organizing a cooperation, some kind of solidarity to face the pandemic. How could the government not do the same?
The issue, of course, is confused and made more complicated when you've got the United States threatening to prevent Pfizer from exporting because the US numbers may be down. You've got AstraZeneca saying they have problems too. Is it not inevitable that countries will put themselves first? That's just the way it is.
it is a possibility, but it is not common sense because, again, it is a pandemic. If we want to start traveling, working, meeting people again between France and US and Europe, etc., we have to try and protect as many people as possible. Otherwise, we will altogether fail. So there is no room for nationalism, even if I agree with you. It is a threat, but we really have to fight against it.
Thank you.
The European Union has made contracts with as many firms as possible. I think this is another way to try and avoid, shortages and crises.
Thank you for joining us. I appreciate it. Thank you. You talked there, the Member of Parliament talked about the European Union making contracts. One of the companies that the contracts is with is Johnson & Johnson. And the arrival of the J&J vaccine might soon ease the shortage. The EU has secured 400 million doses. And the chief financial officer of J&J tells me the company is nearly ready to seek emergency use authorization. He's optimistic about the vaccine's results and efficacy in large-scale clinical trials. And I asked Joe Wolk when he expects to be able to see the data that we can then share.
Right now, Richard, we're looking by early next week. The scientific team is going through kind of the final stages of a very robust 45,000 individual study. It covered 3 continents, 8 countries. Some of those countries include South Africa and Brazil. So as we hear about new strains, that presents, an opportunity where maybe we'll gain some insights on some of these new strains once the sequencing is done. But we're looking at no later than early next week.
If that's the case, when this is the how long is a piece of string question. When likely first jab in arm?
That's a great question in terms of first jab in arm, and it presumes a lot of ifs. So certainly we want to get that emergency use authorization based on some of our peers. That's been a couple weeks in time. We want to make sure, too, that the government authorities are approving of our manufacturing facilities. I don't anticipate any setbacks, but I'd hate to speculate as to when the first jab in arm might be. We'll rely on Dr. Paul Stoffels to give that information out in a couple days here. Understood.
Once you've got it, and one assumes it'll be sooner rather than later, your vaccine is different. It doesn't require any major refrigeration.
Correct.
And it's single dose.
That's correct.
And assuming it has an efficacy rate, and I don't have any reason to doubt that it'll be in the high numbers like everybody else's, where's your biggest market for this?
Boy, that's a great question. I think right now, every market is a big market, right? We know that through our decades of research in infectious diseases, one of the best things we can do to stunt the pandemic and even stunt variants is to have people vaccinated. So we have supply agreements with the United States, with the European Union, as well as Gavi, the Global Alliance for Vaccine and Immunizations, for developing parts of the world. So we see this as a global opportunity, a global need, quite frankly, in terms of addressing what is, on the forefront of everybody's mind across society.
I was somewhat naive at the very beginning when I heard of all these other vaccines being made, and I heard for Pfizer and Moderna at the front, and I thought to myself, why are they bothering? I mean, if there's a front runner and a second and a third, why is everybody else getting into this game?
Yeah, listen, I think at the time, if you think about, I will classify this as really a medical miracle to think that this time last year, Richard, we really didn't even know the strain or the sequencing of the virus itself. And today here we're talking on the cusp of having 2 vaccines already approved. Congratulations to Pfizer and Moderna, and then potentially our vaccine here in a couple days with some data pending approval. I think at the time, nobody knew what was going to work. We had a great deal of confidence, given our work in Ebola, in HIV, with this particular platform, that it would be safe and tolerable. We had studied over 100,000 individuals and clinical trials leading into this vaccine candidate. What we were waiting for and what we'll see hopefully in a couple of days is the efficacy. And nobody could really predict that. So I think it was smart to have a number of shots on goal, if you will, by the life sciences industry to address this pandemic. We know that good health is kind of first and foremost in terms of having a good economy.